My name is Jerry Cromwell. I'm a lecturer in health economics in the University of Massachusetts College of Nursing and Health Sciences. Currently I'm teaching 3 courses, basic health economics for the PhD program, a course teaching students how to conduct secondary data analysis with surveys and government reported data, and then also a quantitative research colloquium for advanced PhD students who are completing their PhD theses. We recently completed an evaluation of the largest disease management program that Medicare has ever run, with 20,000 beneficiaries assigned to each of 8 commercial firms that then use remote nurse coordinating centers to help patients, advise them with their health care, their medications, seeing the physicians, taking their tests, and the like. There was a randomized 10,000 control group used to determine the impacts of these nurse call centers on the quality of care, the processes of care, their utilization of hospitals, nursing homes, and emergency rooms, and then whether or not this program saved the Medicare program any money. What we found was that the effects on the quality of care were limited, with only 14 of 40 successful changes in their quality of care. There were really no intervention effects from these commercial firms on hospital utilization rates, emergency room rates, readmission rates, those basic statistics that drive the healthcare cost. We found that none of the 8 programs produced statistically significant savings. 3 showed savings, but they were statistically very minor and not regarded as evidence of program success. In fact, 5 of the 8 intervention commercial firms dropped out prior to the end of the project due to poor performance. Our team recommended that they evaluate an alternative approach called the medical home. The federal government now has several demonstrations ongoing of medical homes that are grounded in physician practices working with nurse practitioners and their own patients to try and help them manage their own health care, their nutrition, their medications, and to avoid unnecessary utilization of hospitals and emergency rooms and spend more time with the physicians and nurses in the community practices.